Hello. Hi, my name is Alex Ortiz and I'm gonna be your provider for today. Okay, so I'm gonna clean my hands, I'm gonna do hand hygiene. So first of all, I'm gonna do an assessment. This assessment is for your head, eyes, ear, nose, throat, and your neck. Okay. So we're gonna record this video, and I'm your father, and I'm giving permission for recording this video and post it on YouTube for my instructor to see it. Okay, you agree with that too, right?
Yes.
Okay, and I'm the father, so I'm okay with that. So first of all,
and also, little ones have to listen to big ones.
Okay. So we're gonna start this one with the assessment. So with the assessment, we're gonna start with assessing your hair. So that's the first thing that we're gonna start with the hair, okay? So we're gonna check for the texture of the hair. You have a good texture of hair. So we also gonna
tell you something. Right here, it kind of hurts.
Okay,
right
so we're gonna check on all that, okay? Where it hurts right here.
And it hurts a little bit upper.
Here.
Right here.
So as
you see where my hand
at this point we're just documenting whatever the patient says, okay? I don't feel any lumps. We're gonna look for cyst, no cyst. I'm gonna check that, make sure there is no lacerations, discolorations, the color, and all that kind of stuff. It's really good, okay?
Okay.
So that's good. So now we're gonna move with inspection of your eyes. Let's start with doing the visual acuity test. So with this one, we are going to check for your eye vision. So here I'll have this one because we have the little one, the single card, and we're gonna have her read this one from 6 feet. Okay, so that would be probably about here. All right, Valentina, can you start reading the first line?
E.
The second one?
LT.
The fourth one? The third one?
FPH.
The fourth one?
OLCF.
Okay, the next one?
DHJBS.
Okay, you still do that one, okay. The next one?
EPTZO.
Okay, and the next one?
CFVHJ.
Okay, you got it. And the last one?
No, I can't.
Okay. All right, so we are
2025?
2020, okay? So
Yeah.
now with this one, we can also check. No, it's okay. We can check with cover one eye. Tell me which one is the smaller slice that you can see. Okay, I'll have you cover this one. I'll cover you for you. So we're gonna do that right. Can you read it for me?
ELTFPHOL.
Okay, so 2020. Then we cover the right eye, and we do this with the left eye. Now you open that one. What's the? You read the same one?
You know I can still see.
Yeah. Okay. I'll close it. Closer. Which one? Can you still see the same one? Can you read it?
ELTFPH.
Okay, it's closed. Okay. So we're gonna give 2020 for your vision. Okay, so that's good. Good job, Valentina. Good job. So we'll continue with the inspection, okay? We did the test of vision and all that. So with the inspection, we're gonna make sure that we check on your eyes. We check on the sclera of the eyes, the conjunctiva of the eyes. We check that they're round, symmetrical. We check there is no discoloration. They're with the normal color. There is no basals drainage and nothing. Excuse me. We're gonna check on the sclera, like I said, the iris and the cornea. Let me see. Okay. Now, after we're done with this one, we are going to do a popular response. So for that one, I am gonna look for my flashlight. Where's my flashlight?
There it is.
With the flashlight. Okay, I don't see my flashlight, so I probably just gonna grab this one. Okay? So I'm gonna take the my ophthalmoscope. With this one, I'm gonna shine the light. Okay.
Okay.
So I'm gonna start with this side, and I'm gonna check for papillary response. They should constrict, and the other one should constrict too. And then I'll check for the other one. It should constrict. Okay. So after this one, I'm gonna check some other tests. I'm gonna check for your oculomotor, the trochanter, and your abductions and your nystagmus. Okay. So with this, I'm gonna have you follow the light. Okay. So like I say, I'm gonna have you follow the light. And then I'll turn off the light and I'll have you follow the object. I'm trying to get able to see. They can see me. Okay, so I can see that you. Then I'm gonna do another test, which is the confrontation test. With the confrontation test, I'll have you cover this side. And then I'll go with my hands like this. Can you see my hand?
Yes.
Now tell me when you can see my hand.
Yeah.
Okay. Then I'll continue with can you follow my finger? And then I'll shine the light from far away, and then I'll get closer, and it should constrict also. The more closer you get, the more that it's gonna constrict. Okay. So now I'm gonna do my ophthalmoscopic examination. So with this one, I'm gonna go left to left and right to right, okay? So just look at me, okay? So I'm gonna go with my, first of all, I'll do the left side. So left side to that one, okay? So I'm gonna grab my telescope with this one, and I'll turn it on. Okay. And then I'll find the, okay, I can see it now. Don't move it, okay? You can see it. Okay, I can see that. You lost it. You move it. Okay, there you go. Okay, so now I can see the optic disc, the veins in there, and all that. Okay, so now I am going to use the other one. Okay, so I will do this one. Look at me, mamita. So look at me. Okay, so it's right to right. Okay, so look at me. Open. Okay, good. Don't move, mamita. Okay, okay. Okay, let me start again because I couldn't see the optic disc in there. Okay, just follow. There you go. Okay. All right, thank you, Mom.
You're welcome.
All right, so I saw this optic nerve, the muscles and all that. So okay, now we're gonna move with the nose. So with the nose, we're just gonna do an inspection, okay? So with this one, we can probably even check into that. Make sure that if we have to change something, we'll change it. But in this case, we're just gonna see. We're not gonna go inside. So we're basically checking for drainage and all that kind of stuff, okay? So there's no drainage on the nose. Now I'm gonna check for your, gonna palpate your frontal and your maxillary sinus. And they're good, okay?
Okay.
Then so I'm gonna continue. Yes.
I just only said.
Oh, okay. Then you palpating your nose. Everything looks good. On your mouth, everything looks good. Can you smell? See if you can pass air with your nose. Okay, so now we're gonna do another test, okay? I'm gonna have you cover your eyes like this. And this is what I have in here. Tell me what is this one? I'll close one eye. I mean one nostril. What is this one?
I don't smell it yet. I felt something.
Like what? No, you have to cover your eyes.
But what about my nose?
I mean your nose and the one side of your nose and your eyes. What it smells like?
Flower.
Like flowers? Okay, it's flowers is the desodorant, okay? Okay, again, close your eyes and this nose, okay? And then I'll have you do this one. What is that?
I feel like I smelled it before, but I don't remember. I don't feel like it was that then. Can I say its name? I feel like I
Yes.
know. Sanitizer?
Yes, it's sanitizer, okay? So she got it right. Those are the hard ones and I don't have that much available right now. Okay, so now with that one we are gonna check on your hearing, okay? You can hear me fine, right? And you don't have any problems with hearing me, right?
No, I don't have any problem.
Okay, I'm gonna do another test, okay?
Okay.
This test goes with the whispering, so I'll have you cover one side of your ear. And then with this one, once I have you covered this one, I'm gonna say something on this side, okay?
Okay.
Apple. What did I say?
Apple?
Yes. And I'm gonna say something else over here, so I'm gonna whisper on this side, okay? Bananas.
Banana.
Okay. You got it. Thank you, Valentina. You're so good.
Well, actually, I didn't mean to say that. I meant to say bananas.
Okay.
Because I heard you said bananas.
So now I'm gonna grab my other the fourth, and after I did that one, I'm gonna do the Weber and the Reimer test. Okay. So with this one, I have my fourth right here. I'm gonna with the Weber, I'm gonna put this on your top of your forehead. What we want is just to hear both sides equal and symmetrical. Okay. You hear that on both sides? Same thing?
Yeah.
Okay. Now we're gonna do this. That was the Weber test. So with the Weber test, like I said, we're gonna say that it's symmetrical on both sides. Now we're gonna do this again. Sit down, fine, okay? Just giving her instructions what to do, okay? So I'm gonna put this on your ear, okay? On the back of your ear. Can you hear this?
Yes.
So this one just checks for conductivity on that side. And then on this side?
Yes.
Okay, that's good. So that's the Weber so then I'm gonna inspect the external ear. Make sure that you don't have any discharge. And make sure that you don't have any discharge. Everything looks good. I'll check with the light. So but this one I have to change the neck of my ostoscopic to do my ostoscopic examination. So I'll check with this to make sure the external of the eye is okay. So
You got it?
yes.
You finally got it.
So everything looks okay, no discharge. Everything looks okay, no discharge. Okay, so now I am going to get closer to you. I am gonna check with this one. I'm gonna check and do my inspection. So with the child, I pull down and back, and yeah, down and forward, querida. I mean,
Down
and forward.
and forward, I said.
Yeah. Okay, yeah. So, okay. So that's
That feels like kind of ticklish.
the corneal light. I saw the tympanic membrane, the corneal light, and things like that they're within normal. Okay. So now on this side, I'm gonna do the same thing. Okay. So I'm gonna grab with this hand. I'll grab it like this, and with this one, I'll check it like that. Okay. So I'll pull, and then down and back. Okay. A little bit of wax in there. Okay, so good. Alright, so that makes that test okay. We were able to see that just a little bit of wax in there, so that's all. So now we're gonna go with the mouth. I'm gonna inspect your lips. Let me see your lips. And then I'll have you open your mouth. And I'm gonna check inside for your, if I'm using this one, just make sure that I get a new one. Okay, open your mouth. I'm gonna check your palate, your uvula, your tonsils, your tongue. Can you push out your tongue? Can you stick it out? Can you move it to the sides? Okay, so there's no problems with the tongue, okay? And I can see you have a little bit of caries, so you have to go to the dentist for that. Your soft palate is good, so it's all good, okay? Yeah, so then I'll have you, I'll check on your, all that. So now I'm gonna go with your neck, okay? So with the neck, I'm gonna put like this. Can you raise your shoulders? Okay, then I'll do one side. Can you raise this one? Can you raise this one? So now the head, I'm gonna put my hand like this. Can you push towards my head? Now can you do this on this side? She has a good son. So now with your shoulders, can you up, down?
Down.
Can you move your head to the side, to the right, to the left? Can you put it like this? And can you extend it like that? Okay, just to make sure that you have a good range of motion, okay? I'm gonna palpate your lymph nodes, okay? Stop, being silly, okay? I'm gonna palpate your lymph nodes. So with that one, we're gonna go with the posterior. So that one is gonna be here. Then we're gonna go with the anterior cervical, posterior cervical. She's so ticklish. Then we're gonna go with the submental. Let me see, submental is right there behind your neck. Okay? Submandibular. That's it. That's one more tickle. So the mandibular is down here.
Wait,
Oh my goodness, Valentina, stop doing that, okay? Subclavicular, the subclavicular is gonna be here in the clavicle. Then occipital. And then the last one is gonna be the tracheum. Tracheum. So the size and the back is here. And all that, okay? Alright, so the last thing that we're gonna go for this video is just to check on your thyroid gland. So with that one, I'm gonna have to go in the back, and I'm gonna try to explain this procedure because I know that she's gonna be like all ticklish again. With that one, I'm gonna grab this in here, and I'm gonna go having her try to swallow while I'm palpating the thyroid gland. Can you swallow? Okay. Now I'm gonna go in the front and I'm gonna do the same thing. Can you swallow? So with that one, we're inspecting also that there's no problem, no deviation, no swellingness, that there's no laceration, nothing on the neck. And I guess that's gonna conclude our video for today. Thank you very much, Valentina.